Indiana County, 101.1 FM and AM 1160 WCCS.
Indiana in the Morning, always presented by First Commonwealth Bank. Time to be first. Member FDIC. Mr. Computer's having some difficulties waking up here this morning, but thankfully Dr. Shiva Mukkamalla did not have trouble waking up. He's actually with us here this morning on Indiana in the Morning. So we'll wait for that computer to go, but we'll talk a little bit about a topic that we have been visiting quite often in this month. This is Colon Cancer Awareness Month, and Dr. Mukkamalla joins us representing the Hillman Cancer Center at IRMC. Our visit presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Good morning to you.
Morning. How are you doing?
Wonderful. It's good to have you back in the studio with us this morning. We were just thinking, you've been here for over a year now.
Yes.
Yeah.
Yeah, it's been a year and 3 months now.
Yeah, well, let's talk a little bit about colon cancer. Obviously, that's a concern of anybody at the Hillman Cancer Center, all types of cancers, of course. When we think about colon cancer, though, we spend a lot of time talking about prevention, rightly so, getting your screenings, having the colonoscopy, and going through all of those protocols. Some people still end up with colon cancer. It's a very deadly cancer. But the treatments are more and more hopeful. Would that be a good way to term that people who have colon cancer, they have more hope now than maybe they did 5-10 years ago?
Yes, definitely. More so in the last 5 to 10 years, there is definitely hope. The outcomes have improved significantly. And yes, the emphasis should be on prevention always. So screening plays a very important role. And it's important to make sure everyone is aware of the right age to start screening and to make sure that they do have the information to seek help when they are in need for a colonoscopy.
Yeah, well, we certainly endorse colonoscopies, but if cancer is found and the treatments have improved so much, what was behind the fact that that treatments have improved and outcomes are much better now than they were? Are advances within the research or in the way that it's done?
Yes, so early stage colon cancers, when detected early because of colonoscopy, they do have good outcomes, and we tend to improve them and decrease the risk of recurrence by using chemotherapy. The developments have taken place in the last 5 to 10 years are more in people who end up with more advanced stage cancers where the prognosis has not been great. And now it's different. We have several new drugs, therapies that we can use to control and treat these patients and increase their survival significantly while making sure their quality of life is maintained. And that is with the advent of new targets on the cancer and use of immunotherapies, and also several molecules or pills that can be used for specific mutations in colon cancer. So that's where we are seeing a lot of advances. And yes, it will actually change how we manage early stage colon cancer as well, and how to use those advances in early stages and make sure that we further improve the outcomes in stage 2 and 3s.
So finding the cancer early is a key, but if it is advanced by the time that you find it, the treatments are so much better. Does colon cancer, the presence of colon cancer, always mean I need surgery?
Yes, other than the case where it is advanced stage or found late, even then there is role for surgery in a few case-by-case situations. Yes. Rectal cancer, which is grouped together as colorectal cancer, but it is dealt with a little differently. There is new and upcoming data and evidence to suggest certain patients can avoid surgeries after undergoing intensive chemotherapy and radiation treatments. So that's upcoming data, and we are seeing more and more patients able to get away from surgery. But it's a case-by-case basis. Surgery is almost always part of treatment.
And when someone enters the protocols for colon cancer, I know that it will depend upon how advanced it is once they seek the treatment. But do we talk about survival rates in 5-year increments, in 10-year increments? How is that quantified?
Most of the studies, they look at survival rates in 5-year increments. But population studies and large-scale databases, we can always look at 10-year survival rates. So this applies primarily to more early-stage colon cancers, wherein, of course, the patients are doing well and definitely way beyond the 10-year mark, so we can have those estimates there. In more advanced stages, I think 5 years is still a milestone that we kind of use and measure the outcomes.
When we think about the factors that would be more conducive to developing colon cancer, we have heard diet certainly is a big part of this whole ratio, of this whole equation. And following a diet, once you have been diagnosed with colon cancer, that is still very helpful, is it not?
Yes, it is. Definitely it is, because overall health upkeep is important even after diagnosis. Yes, we may not be so much, people may not be so much interested in following those restrictions after they have been diagnosed with a colon cancer. But nevertheless, once you're cured in early stages, you still have to follow that to prevent another occurrence. So it's important. And overall health upkeep is important after being diagnosed with a cancer and going through a lot of treatments to make sure, your rest of the health aspects are maintained. So it's always important.
Is someone who has had colon cancer in the past more likely to develop it in the future?
There is, and the risk goes down with time, and that is why the way we monitor patients even after they complete all their treatments for cancer, the stage 1s or 2s or 3s, whether it be surgery followed by some chemotherapy or so, we still have them on what we call surveillance. We keep a close watch on them. As time goes by, say for the first couple of years, we follow them closely, and then space out a little bit for the next 3 years. And thereafter, the emphasis is still on getting regular colonoscopies as recommended by the gastroenterologists or surgeons.
I have enjoyed our conversations with Dr. Clark talking about the factors that, the research indicates are more likely to indicate that colon cancer could be a part of somebody's life. And there are factors. Diet is certainly one. The level of physical activity is another. Did I read correctly? African American men are more likely to develop colon cancer. Did I read that correctly?
Again, that I think we have to validate further, but yes, the genetics also play a role sometimes, and also it depends on where the data is coming from. So there is always a small difference between different ethnicities in terms of cancers, and it also has to do with where the study was done. But yes, there is some data pointing towards that.
Yeah, and I believe I also read that colon cancer in the United States is a much higher incidence than in other countries. And I would assume that that's dietary as well, maybe hereditary, but dietary seems to me to be something more likely.
I would say dietary more so than hereditary, because hereditary cancers, yes, they do exist, but I don't think that's the reason for the higher number of cases. Dietary lifestyle, and especially more of processed foods or red meat consumption, a lot of these factors might be playing a role.
Now, we're talking about colon cancer here today, but in the overall picture, Hillman Cancer Center at IRMC, I think that's one of the great things that have developed in the last 10 or 15 years here at IRMC is the fact that we have Hillman Cancer Center right here. It's the same Hillman Cancer Center that operates out of Pittsburgh, and so the same quality of care and the same protocols are followed, the same treatments are available. It really is a wonderful thing for this region, isn't it?
Yes, we are Hillman Cancer Center in Indiana. So yes, all the protocols are same. We also have several clinical trials that operate out of the main campus that we also are enrolling patients here into. And yes, we do follow the same pathways that are followed at the main institution, and which is being an NCI designated cancer center adheres to the national standards.
Yeah, it really is indicative, though. We really do need to get those screenings and follow that, because while it is one of the most prevalent cancers, while it is also one of the most deadly cancers, it's one of the most preventable cancers.
Definitely. Yes, you get the colonoscopy, take care of any precancerous lesions, then yes, you are avoiding deadly cancer.
Yeah, it's something that needs to be done. And I think Dr. Clark said 45 now is the age that they recommend?
Yes, they did change the age because population studies, as you had mentioned, were done, and they saw more and more younger patients were being diagnosed. So after taking all that into consideration a few years ago, they changed the age. The starting age for a general population to start colonoscopy is 45. It can be sooner for patients with high risk based on family history or genetic predisposing conditions. Then they may have to start sooner as well. But otherwise, for general public, it's 45.
And then generally 3 years?
Depends on what they find. So if it's a colonoscopy, a nice, well-prepared colonoscopy evaluation, if it's clear, they usually go for every 10 years. Sooner, 3 years or 5 years, depending on any findings like polyps or something that needs a more close follow-up and reevaluation.
Yeah, all right. Dr. Shiva Mukkamalla with us this morning. The Hillman Cancer Center, operating at IRMC, is such a tremendous advantage. Folks need to know that there is hope if you have been diagnosed with colon cancer.
Yes, definitely. There is hope.
Thank you so much for coming in to visit with us today. We appreciate it.
Thank you.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. 8:24 in the morning. Boomer Sports next, and then Josh in our WCCS newsroom.
This is Boomer Science with the Sports Minute, sponsored by TGL, presented by SoFi. Tune in